Good morning, Dr. Hoffman. Would you care to address the community?
Yes, thank you. Um, so I'd like to take a minute today up front to talk about what it means to quarantine and isolate and where testing comes into that. So quarantining process is where someone who has been identified as a contact to someone who has known COVID-19 is recommended to stay in their home away from everyone else in society for a period of 14 days. We did recently change that to allow for 10 days if you can't quarantine for the full 10 days. If someone is positive for COVID-19, they're recommended to isolate for 10 days. And that has not changed. That recommendation remains the same in Humboldt County as well as across the state of California. There is nothing you can do to change that 10-day isolation period. Retesting does not shorten the period of time nor lengthen it. It stays at 10 days. So we've been hearing concerns from the community that folks are going out and trying to get retested. That could potentially expose people who shouldn't be exposed and don't need to be exposed. If you're in isolation, you had a COVID-19 positive test, you need to stay home away from everyone else for those 10 days. So please don't get retested. Please stay home. And if you ever have any questions, you can always go to our Humboldt Health Alert website or call the Joint Information Center to ask a question. If you have medical concerns, please call your medical provider. Thank you.
Thank you, and now we'll move to our questions. From the Lost Coast Outpost. Earlier this week, the Wall Street Journal reported that there is now an abundance of monoclonal antibody therapies available nationwide, largely because many doctors are reluctant to administer them and many patients are reluctant to accept them. Last month, Dr. Ennis said that he expected it would be several weeks before Humboldt had access to these drugs. Do we have access to them now, and are they being used?
So we do have a very small, limited quantity of these medications in Humboldt County. The physicians who treat COVID-19 are aware of this. In fact, they had a meeting earlier this week to discuss its use. The administration of them can be difficult and tricky and requires a special infusion center, something we don't have here in Humboldt County. But we're looking at ways to try to utilize the very small quantity that we do have with our partners in the hospitals and other treating physicians in the community.
Thank you. From the Lost Coast Outpost, yesterday's press release said, as of today, Humboldt County has been allotted 5,500 doses of COVID-19 vaccine, Pfizer and Moderna combined. At what point will these vaccines start being administered to non-healthcare workers?
Yeah, so we are currently in phase 1A of the vaccination process, which is, you all have heard by now, is healthcare workers and residents of skilled nursing facilities. We are working with our community partners diligently right now to make sure that vaccine gets out as quickly as possible and as safely as possible. 1B has not completely been determined by the state, by CDPH, as to all of the different folks who will be in 1B. We have some early ideas of who that will be, which includes anyone age 75 or older, as well as a large number of non-healthcare frontline workers, which likely would include teachers, first responders, people who work in agriculture and industries that cannot distance, grocery store workers. So there's a lot of people in that, and they're really working right now to figure out where in those tiers of phase 1B each of those individuals will be. What we hear from the state right now is that there's hopeful expectations that we could start moving into 1B in late January or early February. Of course, these estimates are tied to vaccine production, distribution, and other concerns that could come up. So we will definitely keep everyone informed as we know more, and that's what we know about the process right now. Thank you.
Thanks. From the Lost Coast Outpost, Do you have any estimate of the percentage of the county's population that has been infected? One that includes both symptomatic and asymptomatic cases, or diagnosed and undiagnosed cases?
So we know what our total case count is in the county currently. And if you take that number and divide it by the population, it's roughly or just over 1%. So those would be the definitively diagnosed patients who both asymptomatic and symptomatic got a PCR test confirming that they have COVID-19. There are many estimates of how many we miss. Roughly potentially 5 times that number. So we could say potentially upwards of 5% of Humboldt County has been infected with COVID-19 at this point, leaving the vast majority of us, with vulnerability and susceptibility to COVID-19. Thank you.
Thank you, Doctor.